And we have a great panel of guests that never stopped working. They and their colleagues worked throughout the ups and downs of this pandemic. Joining me now is Dr. Steven Valassis, Chair of Emergency Medicine at Hartford Healthcare St. Vincent's Medical Center, Stanford Police Chief Tim Shaw, Westport EMS Deputy Director Mark Hartog, and Jake Tavello, Vice President of Stu Leonard Stores. Thank you all for being here. And Dr. Valassis, let me start with you. I want to talk a little bit about the height of the pandemic and what it felt like during all of that. What got you and your staff through some of those tough days?
Well, I mean, looking back at this past year, it was quite a ride that we were all on, and we're not finished yet. I remember when this first started, when we first started seeing, the first few patients. What really happened is the hospital emptied out. People were not coming to the hospital, and then waves of patients with coronavirus infection were coming in. And really, we were kind of, as a medical community, trying to, create treatment plans on the fly. I mean, there were not textbooks looking back in terms of what we had to do. There was, anecdotal evidence sent in from other countries, from Italy, that were dealing with it, and some of the things that they taught us turned out not to be true. Here at St. Vincent's, I mean, we had a team of doctors and nurses who got together and really created the guidebook for taking care of these patients. At our height, we have an intensive care unit and a step-down unit. We ended up having 5 critical care units throughout the hospital taking care of these patients because so many of them needed critical care, needed really amazing medical care and nursing attention. And, really, today being, this is Nurses Week and Nursing Day, I think there's a big thank you that we need to say to all the nurses who were there caring for these patients. Families couldn't be there with their loved ones. They weren't allowed in the hospital during the height of this. So, we had really wonderful caregivers who were there at that bedside taking care of these patients like they were their own. And it was really, it was difficult. Initially we saw some older patients coming in, and we expected that from the nursing homes. But then we had younger patients who looked like us, patients who were younger than us, and really had really significant illness. I mean, our first patient here, his name was Rodney. He ended up being in the hospital for several months. He ended up being on a ventilator. And when he woke up, he didn't know what month it was. And we all, cheered him on through his course, and we all knew his name. And there was a day that I will never forget. It's the day that Rodney walked out of the hospital. He walked
Doctor,
up on his feet.
We actually did a story with Rodney. Remember that very well. Let me bring in Mark here real quick. Paint us a picture. Calls were coming in for people with medical emergencies, whether it was COVID or another issue. What were you telling your paramedics as they responded to those calls?
Well, we were kind of fortunate in that we had done some preparing for it well before it actually hit in Westport, which was one of the first hotspots in the state. Back in December, actually in November, we had already had scheduled to do refresher training for all our paramedics, all our EMS staff, as well as the firefighters and police officers on mask use and use of other personal protective equipment. And then when it really started, when we started seeing what was happening in China, we amped that up. We reinforced the use of N95 masks and fit testing everybody for those masks, and make sure that we had the training and the equipment to do it. So when we first had the first case, we were actually fairly lucky in that we were prepared for it. And yet I still remember when I heard the first call go out to our crew for a young person having difficulty breathing and possibly a COVID patient, my heart just sank and said, okay, here we go. This is the start of it. And it had been nonstop since then. And
let's bring in Chief Shaw from Stanford. Your officers respond to everything, obviously, from car accidents to personal disputes, encountering the public all day long. How worried were your officers?
Yeah, I think because of the unknown, that was probably the biggest thing, to educate our officers the best we could. We met with the health department, and they gave us the information to pass along to the troops. But the non-essential calls, the 911 calls that were not deemed an emergency, when we were able to triage those, we were able to do it through the phone or in person, but not necessarily, in contact with the people. Our issue came with the 911 calls where we had to go hands-on with people. whether it was an accident, whether it was, something else, where the officer had to make close contact. They had their PPEs. We did the best we could, but in our world and what we do, it's immediate, it's spontaneous sometimes, and we're forced to make decisions, to save the people or to help the people who are in need. So we did the best we could. Some of our people did come down with COVID. They were supported throughout, and I think it was a great effort by the city to educate people, and I think we got out of it a little quicker because of that.
And Tim, what lessons can you take away from the pandemic for your force?
Be prepared for the unknown, and the best you can. I think having meetings with the hospital it played huge dividends for us, the health department, to put the officers at ease. So I think we communicate with our other agencies, our stakeholders, and I think the new normal for us is staying in contact. So if something new comes up, our officers are prepared.
Let's go back to Mark here for a second. We often saw images of first responders coming to support hospital workers outside with their lights and sirens. How important was the sense of community during this time?
There's no question about the fact that we could not have gotten through this pandemic without the support of everybody that was involved in patient care, right from our first responders, the police officers and firefighters, to our EMS crews, to the nursing staff in the emergency rooms and the doctors in the ERs. This was truly a team effort to take care of these patients and ensure their health and survival.
Dr. Valassis, let me bring you back in here now. How important was the support from the community to your staff?
Well, listen, it absolutely took a village to care for the patients and to keep the staff going. There were just so many beautiful gestures from the community. I remember when it first started, people were dropping off boxes of masks. We were very lucky that we had a good supply of masks here, but community members were coming in and dropping off N95s from painting projects or when they were doing woodwork. There was a supply of food that was brought to the frontline staff, and the parades and things that happened. I think there's a lot that our eyes have seen and things that we've experienced, and I think we're going to be unpacking that for a long time. But knowing that we had the community support behind us and that everyone was in this together, it was very important to us.
And we haven't forgotten about Jake with Stews either. Coming up, we're going to talk a little bit about grocery stores and all that they went through in the pandemic. You're watching The Next Normal.